Okay, thank you very much, everyone, for being here. Sorry for the tech snafu. I'm going to let everyone on our page know that we're going to be live on my page or live on my own wall and not on the page as we had planned. Let me do that really quick. Okay, thank you very much, everyone, for being here. Sorry for the tech snafu. I'm going to let everyone on our page know that we're going to be live on my page or live on my own wall and not on the page as we planned. Okay, I am going to see if I can mute this. Okay, there we go. Okay, so let's start. So just to let everyone know sort of what we're going to be going over today, we had so many good questions that came in. So a few things that we are going to cover. Number one, how COVID-19 affects the GI tract. Number two, how are the acute GI symptoms of COVID-19? Number three, is there any role for fecal oral transmission of COVID-19? Number four, what is post-COVID-19 GI syndrome? Number five, does the vaccine help with post-COVID GI syndrome? Number six, how IBD patients do with COVID-19. Number seven, what happens to the liver during COVID-19? And number eight, how do you approach to a patient with GI symptoms post-COVID-19? So to start, our first question series is going to address the esophagus, GERD, and atypical chest pain and dysphagia. So our first question is, I've been diagnosed with reflux since COVID, which affects mainly my throat and ears. I do not get heartburn. Can reflux happen after COVID-19? And I'll throw that to our panel.
Okay, Schmulson, can you answer?
So you want me to answer that one?
Yes.
Go for it.
Okay, so I don't know if you can hear me well.
Yes, we are hearing you.
Okay, so yes, so after COVID-19, actually, or actually even during COVID-19, we can have gastrointestinal manifestations. Up to 45 to 50% of the patients have GI symptoms during, before, or after COVID-19. So they can have any type of digestive symptom, from reflux symptoms to dyspepsia, to abdominal pain, bloating, diarrhea. So yes, we have seen patients that have post-COVID-19 reflux symptoms, and apparently there's some data from the group of Giovanni Barbara that they are seeing that the symptoms from the upper part of the GI tract are the ones that are remaining the most after COVID-19.
And let me add to that, these post-COVID-19 reflux disease can happen, which can be due to the virus infection, or it can be due to the medications that you are taking, as well as the changes in the lifestyle. So lifestyle is an important part of reflux symptoms. Means if you have more sedentary life, you are more susceptible to get reflux. So it's not just only COVID-19, but changes in our life after COVID-19, and the medication that we are taking can also trigger reflux disease.
Well, also maybe one point of experience, the reflux actually itself can start another sequela of problems, because with the reflux, and sometimes they feel like heartburn is present there, or sometimes they don't have even this event making them aware of the issue. But when they regurgitate food from the stomach without having heartburn, this can go later into their ears. It can go to their trachea, and it can affect the respiratory tract. So those two systems, which go almost hand to hand, they end up both in the mouth. they can affect the way patients they feel, and then reflux, which can affect, again, their ears, even their throat, their sinuses. This is very, very vague kind of presentation in clinical arena, can be presentation of the very globally involved tract of respiratory and GI system, which are responding and require further investigation and just going through the treatment later on. So please pay attention if something feels like you are having some chest pain, and sometimes those chest pain are so severe that people are scared, thinking about the heart attacks. And that's very typical for many patients, but they are related to reflux. And to distinguish what is what, you have to go to emergency room. They have to test you and make sure they can exclude the fact that you have heart attack. So mimicking of other problems in the GI tract is very typical. So please pay attention and don't ignore any of those symptoms.
So here's an interesting question. We get questions along this line all the time. I have tried apple cider vinegar, other antacid meds for reflux. Nothing seems to keep it away. What should I do?
I can answer this question. Reflux or acid reflux is a complex finding or a manifestation of GI diseases. We have very solid pathways to address reflux diseases and to alleviate the symptoms. We have acid suppressors, proton pump inhibitors, which are very helpful and very effective in controlling reflux disease. Either apple cider vinegar or these very mild medications can be effective in this condition is not really clear. Whoever doesn't respond to regular treatment and reflux regular treatment for reflux symptoms should see the doctor to perform endoscopy to rule out any inflammation or any ulcer or any changes in the esophageal mucosa. Endoscopy is an important part to do that. If endoscopy comes normal, then we have other tests like pH testing or impedance testing to look at reflux conditions which don't change the mucosa, but the acid or not. We can have also bile reflux, so they can enter the esophagus and affect the sensation in the esophageal nervous system, is enteric nervous system there. So you have to go, you have to start standard treatment, and if there is no response, you go to the next step, which is doing further tests. Dr. Schmulson?
No, I don't have anything to add. I think you covered it very well. I mean, you start with treatments, and if they don't respond, they have to be further study with endoscopy. And if there's nothing in there, you have to go through a pH or pH impedance monitoring.
Maybe I'll add 5 cents only to this discussion, because I found being interesting and was written in the literature that patients who have problem with reflux, and doesn't matter if this is COVID, but COVID obviously can be trigger point for it, or it can exaggerate the symptoms, exacerbate the symptoms. So advice was, please avoid oily food, please avoid spicy food. And something else what was advised was to don't eat processed food. So whatever you can do, something very mild for yourself, something what you, sometimes, we don't have home any remedies, we don't have any medication available, and here are symptoms coming in. What do? You have to find some around, things which can help lower the acid. Old treatment, which was a long time ago, just to help you without any visit to pharmacy, just see if you can neutralize the acid with drinking lots of water and milk, which is very good. And then obviously you have to go with more stronger medication and testing, what Dr. Bashashati said, because you never know that you have only COVID, because maybe something else was already existing, but it was never resurfaced yet. And here you have predispositions. You have situation when those symptoms can pile up, and then you make aware that you are sick. You pay attention to your body. And that's what happens. Then you have to go and seek out actually the diagnosis, which is right one. Go and see gastroenterologist.
Okay, so this is an interesting question. I am diagnosed with hiatal hernia. Does that affect GI issues?
Yes, so hiatal hernia is very common in the general population. I'm probably going to say that probably like 65% of people have hiatal hernia. And hiatal hernia is a factor related to reflux disease, but not everyone who has reflux has hiatal hernia, and not everyone who has hiatal hernia has reflux. So this is something that it's very common. And when someone has reflux, gastroesophageal reflux disease, and they must go into surgery for correcting gastroesophageal reflux disease, that's what they will approach. They will correct the hiatal hernia. So I think I have summarized the relationship with the hiatal hernia and reflux.
So let me add to this. Hiatal hernia is an anatomical defect. It cannot be related to COVID-19, means it's something else.
No.
But it can manifest with epigastric pain, reflux, and if it is large, it can also manifest with GI bleeding. So we have to consider that. In some people with hiatal hernia, large hiatal hernia, they have ulcers there. So it's good to see a doctor and start treating it with proton pump inhibitors, the symptoms. And if you don't get a good response with medical treatment, if you have a large hiatal hernia, you should see a GI surgeon to repair it.
That's correct. I think we already explained anatomy changes in topography in the GI tract, because normally hernia, for those of the audience who doesn't have idea what it is, like Dr. Bashashati just mentioned, you just pull almost like a stomach into the chest cavity. With the pressure, sometimes there is a very low sphincter, which allows for this to happen. Therefore, you have portion of the stomach, which normally is under diaphragm, the muscle which divides chest from the abdomen. And then you have a problem because you can trap food there, and you can have many symptoms which are affected by the fact that you have this anatomical change. So that's the treatment and that's the condition.
Thank you so much. So our next question is, I have GERD from COVID. I've heard that the Moderna vaccine has an antigen that helps relieve bradykinin overreaction that causes all the mucus production. Is this true?
Actually, this is a very tricky question.
It is.
Because Moderna vaccine is an mRNA vaccine. It doesn't have any antigen. So we don't know. So we have to wait for future research on this. But regarding the role of bradykinin and reflux, yes, it is involved in reflux sensation, but it is not the main pathway, as I mentioned. So we have to consider acid. We have to address acid issue before considering bradykinin in this situation.
Yes, I don't think there has been any relationship proven between any vaccine and GI symptoms or improving GI symptoms so far.
Yeah.
And it will be absolutely unprofessional to advise to get one kind of vaccine versus another, because you can prevent problems. So this is not the time, and maybe this is good moment for me to mention that we actually are missing so much of information so far in the research on COVID and the long-term sequelae of it. And that's something what we are actually sincerely asking people to help us out, because we want to have those answers for you. And if you will be able to help to participate in the research and just provide information and your observation and be part of the bigger center which can gather information together, it will be fantastic for all of us. This is how we learn, and we need your help. And that's the battle of everything for us to have ammunition for COVID. We have to have a science, and science comes from patients, and that's you. And that's what we would like to make sure you get this message from us today and help us out any way you can, please.
And I sincerely ask everybody to get whatever vaccine is available to you. Don't be selective, because we have to control this pandemic and we have to get the vaccine, whatever is available to us.
And I do want to point
Moderna,
out,
Pfizer, AstraZeneca, whatever is available.
Everything.
Yeah.
I do want to point out that we do have your current study posted in the group. That is a big help. So thank you very much. And I'll make sure that we point that out to our group members later. So let's see, moving on. Okay, so I have an 8-year-old here with me right now. So our next question is, I was seeing a cardiologist for heart palpitations. I had an echocardiogram and Holter monitoring done for 3 days, but they found nothing abnormal. The cardiologist mentioned that oftentimes what feels like heart palpitations is actually related to the esophagus, the way the heartburn is not actually related to the heart. Can you shed some light on this phenomenon? What causes it and what can be done about it?
You want me to answer that? So yes, this is definitely this is definitely an important issue. So GERD can one of the symptoms of GERD can be chest pain. On the other hand, this chest pain can feel like if it is from the heart. So there are some ones who differentiate or want to differentiate between heartburn and heart pain. You know, it's very important. But before of this, we were discussing about hiatal hernia, and there are some patients which have a big hiatal hernia. So as Dr. Sarosiek mentioned, the stomach goes up in the chest. So when that person that has a big hiatal hernia eats, the stomach will get full and will compress the heart and can give symptoms of chest pain as well. But also reflux by itself can produce symptoms of or palpitations, as the person asked. So yes, there's something that always needs to be differentiated here between reflux or chest pain because of reflux, or palpitations because of reflux, and palpitations or chest pain because of the heart. This is something very important always to differentiate.
And I would like to add that autonomic dysfunction can happen after COVID-19, and that can manifest with palpitation. So we have to keep that in mind, besides considering all reflux symptoms that also can manifest with atypical chest pain or heart symptoms.
There is a condition, I just will throw 5 sentences here, called nutcracker esophagus. They are conditions in a GI tract which are so painful, and they can have the spasm which is there, and the pain which comes with it is so excruciating that's where we have to distinguish. It was mentioned before, I have to stress this out. Please go and double check and make sure you have the right diagnosis, because it's not absolutely acceptable to treat reflux if there is a heart problem or vice versa. Those things, they have to be separated and just go and check on it and fixed with medication or surgical or any other procedures test in the future.
So if you didn't get your response from a gastroenterologist, you can see a cardiologist or vice versa, because it is a team management. It is a multidisciplinary management. You shouldn't focus on just one part. You have to involve all these doctors to figure out what's going on with you.
So our next question, since nausea is one of my lingering effects, I am stuck. How do I keep fuel in my system? When I can't eat or drink, the fatigue is only worsened, as is the dehydration.
So this question should go to Dr. Sarosiek.
Well, nausea, I'll tell you, is very underappreciated symptom. People, they feel sorry for a patient who is vomiting, but because we cannot see nausea in our patients, we usually ignore or don't bring to the attention, for serious treatment. But it's very debilitating symptom. Doesn't matter what its origin, nausea is never a friend of anyone, and we have to treat this seriously and make attempts to find the reason and help out with it. There's many different parts of the body because nausea is just perception in your brain, which is caused by the situation taking place in a stomach, in a sense. So if you have a message and there is a chemoreceptor trigger zone in your brain, which responds with this kind of feeling, you feel nauseated and you want to get rid of food or something that bothers you to go more north, not more south, whatever you want to deal with it. So nausea is very much lingering. Very often patients will have, especially when we talk about gastroparesis patients, they'll have nausea in the morning with vomiting. And then what you have to do, let's say, of course, I cannot tell you more important, you have to go and see a doctor and you have to know the region because it could be something in your brain. It could be, something wrong with not only your stomach, but the constipation. People, they feel very vaguely with all those things. So you have to start to think about the treatment and trigger and focus on the origin of it, etiology of this. What we do, there are drugs, antiemetics on the market. There's many of them, and I won't discuss any of the treatment specific one, but there are medications. But then what we tell patients very often, to don't feel very nauseated or just to don't be as uncomfortable, you have to make sure you eat very small portions of food. You never stack yourself with so much because then makes bloating, fullness, satiety, everything what comes with the territory. So we tell them to eat very small portions of meal more frequently, more often, but small amounts. At the same time, it will be very good idea. Something from my cough, I can tell you what people they do on a plane when they are nauseated. They ask for the ginger ale, they ask for the 7-Up, they ask for the drinks which calm down a little bit the feeling of nausea. Saltine crackers, I learned from the patients, that's what they grab when they feel bad. Sometimes even ginger, just candy, they are very helpful. So those small things can help you out at the moment. And then the appetite, because you don't want to eat when you are nauseated. Yes, you don't. So then you have to just make sure you pass this moment with medication, with approach, with some relaxation. That could be a problem also. Therefore, you have to make sure your diet is very right afterwards. Again, small portions, not too much of fat, not too much of any fiber, and you can move on. Something from the anecdotal information, very often patients, they feel much better when they drink Coke. That's just on a side. It's not a science behind it, but I'm telling you, if you are desperate, you don't know what to do, saltines, ginger ale, and Coke could be something, but then please make sure you find the reason for it, because nausea can show the manifestation of so many different conditions in your body. And brain with the tumors changes there is also something you have to exclude from the list of your diagnosis.
Dr. Schmulson, do you have anything to add?
Well, I just wanted to say that, when we have analyzed the symptoms, GI symptoms that have been reported in relation to COVID-19, it seems that diarrhea is the most common one, followed by nausea and vomiting. So one would expect that this would be one of the most common lingering symptoms, especially because it's in the upper side. And as I mentioned at the beginning, it seems that symptoms of the upper GI tract are the ones that lingering the most. So yeah, that's very important, but you need to be studied, because maybe it's the possibility of something else organic that is in there. For example, there can be ulcers, that it can be actually related to gastroesophageal reflux, but also it may be something which we are now calling post-COVID-19 functional gastrointestinal disorders, or disorders of gut-brain interaction post-COVID-19. And it can have any manifestation in the GI tract. So it's important to consult to the physician for this and study, rule out any organic disorders. And if patients are not responding to usual treatments, there are some other treatments that we are using for these symptoms, such as neuromodulators, that we can discuss afterwards if you want.
Neuromodulators are very important in this situation. Means remedies like ginger, mint, these are good for nausea. And the other thing, you have to consider further testing like endoscopy and gastric emptying testing if you don't have a very good response to any of these treatments. So it's good to see a neurogastroenterologist to consider all these tests, including endoscopy, and after that, gastric emptying testing.
Maybe I'll finish this story because this is very important for nausea. Like I said, it's not something we can ignore. Especially it's a problem with patients who have diabetes. So let's say you are diabetic pre-COVID and now you develop nausea, which obviously could be related to the viral infection. We know it is in some patients. But then you can think about a condition which Dr. Actually Bashashati just mentioned. You know, you could develop lazy stomach, so-called gastroparesis, very slow emptying of the stomach. And that's how the test, a nuclear medicine test with isotope, helps you to make a diagnosis and then get a treatment, because you can get medication not only for the symptom, which in this case will be nausea, but you can also be treated for the reason why you have nausea, which will be very slow stomach. This is different group of drugs which are prescribed in those conditions, and they're called prokinetics. And they can be used in those patients, help out on the end of the story with nausea. But testing is a magic. Then you have diagnosis.
Yeah, and that's we are seeing a lot of gastroparesis and other motility related issues. And this segues nicely into our next section on appetite and food intake or taste. Our first question in this section is, after COVID-19, I feel like I can't eat the things I used to. Is there any recommendation for diet post-COVID to help with GI issues? And I think there are other considerations that I think people are trying to get in there as well. Things like mast cell activation syndrome, what implications that might have.
So I can start this answering this question. Loss of taste and smell is an important part of COVID-19 acute symptoms. And based on the recent study we performed, they coincide with GI symptoms, means loss of taste and smell. And they can trigger a loss of appetite. It is very important that to consider patients who get COVID-19, they may not be able to taste the food, to smell the food as before, and that changes the appetite and flavor of the food. So that's an important part which may take a long time to reverse, because some people have these symptoms for a long time. Also, is due to other complications of COVID-19 and the medications you are taking to trigger, to control the symptoms, you may have loss of appetite. Some of neuromodulators or anti-inflammatory medications can affect our appetite and also the motility of the gastrointestinal tract. Therefore, these patients may not be able to eat. So, anybody wants to add anything?
No, I'm seeing patients that are telling me that they have not fully recovered their normal taste, especially the taste after COVID-19, and they are not able to eat the same things. For example, I remember one of my patients told me, I used to love drinking wine with dinner. I can't. I just don't tolerate wine anymore. I don't tolerate the taste of the wine anymore. So that's something that can happen, and we know very little about this yet. How long it will take to recover? Will it recover? Will they be the same as they? I mean, will they recover their taste as they had it before COVID-19? This is something that we don't know yet.
I think this is also very patient-driven, very subjective. It will be unfair to say just do this or do that, because each of us has different approach and different tastes and different sets of the receptors in our mouth and how we smell and accept the food. But so that's something what has to be taken under consideration, that will be for individual people. Something easy to think about it. If you want to eat and you don't feel like, look at the food and think, is this something what I will feel good eating? No. What about the fact that I will just focus on a very easy food, which I have in my kitchen? Chicken broth, anything what comes, like what tell patients with gastroparesis, please eat some egg, you can have noodles, some rice. Just start with something what doesn't have even enough of the smell which you require to boost your desires to eat, but something very simple. And then if you go through because if you start to broccoli and cauliflower, you will be sicker than before. So that's something what is the last thing on your agenda, but going softly with the soups, with the oatmeal, with some grits, something what is just, it slides down because you need calories. You don't want to lose weight, you don't want to be dehydrated, you don't want to vomit, you don't want to cause problems as a result of your nausea or vomiting and then seek out IV fluid injections at the hospital. That's a different story. So just please think about what baby likes to eat. And that's what maybe at those point you can eat, because you don't remember the taste as much, but you can benefit from the food. Something simple to digest and simple to slide through your GI tract and then don't cause any problems. So baby food will be very good. Drink something together. That's how you start. And small portions, please remember, small portions more often.
Yeah, small portions more frequent, and also consider using boosts, which are available in the market to deliver enough nutrients to your body, because we don't want you to be malnourished. So that's very important.
Yeah, ensure that's right. And both Glucerna for diabetics, there's no enough of glucose to hurt them. So there are things which you can buy over the counter just to keep the calories intake, because you don't want to cause complications from not eating.
Calorie and protein, these are very important.
So this is sort of a lengthy but good question. My daughter, who is 17, had COVID. Her symptoms were limited to nausea and vomiting, and she was unable to eat for several days. She rapidly lost weight and developed persistent GI pain, especially when she eats. 2 separate clinicians have recommended that we admit her into an eating disorder facility, diagnosing her with anorexia and/or refeeding syndrome. But we believe the cause is physical and not psychological, and most likely residual effects from COVID. She's had a CT scan and an endoscopy without any significant findings. We are desperate for answers and recommendations as to how to help her overcome the physical discomfort she's experiencing on a daily basis.
So Dr. Schmulson, can you?
To me, this sounds already like a post-COVID-19 functional gastrointestinal disorder. And I would, seeing that she has a negative endoscopy and a negative CT scan, which is what I would have done as well, I would treat her like post-COVID-19 functional gastrointestinal disorders first. And the way we do it is, as I mentioned before, with the same way we treat all other functional